Hi friends, I'm Dr. Toishi Sharma, Interventional Cardiologist, and I'm here to answer some of the most commonly asked questions. So today we are going to talk about when does a coronary blockage actually need a stent? So friends, a large part of this has got to do with the presentation. So for example, if someone presents to the hospital with a heart attack, then in most circumstances we try to put a stent in or do surgery if there are multiple blockages without waiting for days or weeks for medications to work. And the reason is that if there is a heart attack, then the muscle is already at risk and further damage to the heart muscle can occur if there is any delay. However, if someone is presenting with stable symptoms, now when we say stable symptoms, what we mean is someone is coming to the clinic with chest pains or shortness of breath that have been going on for a period of time, maybe days, weeks, or months. And they have symptoms only when they exert themselves, meaning when they walk up the stairs or walk uphill or they are working in the yard, they develop symptoms. And the symptoms go away whenever they rest. This tells us that the person may be having stable angina, meaning there is a blockage and you have symptoms only when you exercise, but at rest there is enough blood flow to the heart muscle. So when we are dealing with someone with stable symptoms and we find out through testing that they have a heart blockage, then it is a little bit more nuanced. First of all, there are some parts of the heart like the left main or the proximal LAD. If there is significant disease in either of these vessels, more than 50% in left main or more than 70% in proximal LAD, then we usually recommend stents or surgery without waiting for any medications to work. A second situation is if there is only mild disease. Mild disease is anything less than 50%. So if the blockage is 30 or 40%, then it is treated only with medications like aspirin, statin, and a beta blocker. Because this mild blockage is not enough to cause significant symptoms and your pain may be coming from something else like acid reflux or muscle damage, costochondritis, or something like that. Now friends, the third possibility is that there is a moderate blockage in one of the blood vessels. A moderate blockage is anything between 50 to 70%. When there is a moderate blockage in a blood vessel, then we have to do further testing with something called a DFR or FFR. And what this does is it tells us if this moderate blockage is actually causing reduction in the blood flow in the heart or not. One person can have a 60% blockage that is physiologically causing reduced blood flow, while another person may have 60% blockage that is not causing significant blood flow. And therefore we use this test called DFR or FFR to determine for that particular person if that blockage is significant or not. And appropriately, we may need to put a stent in it. Now friends, there is a fourth topic we need to discuss about. As I mentioned initially, if there is a blockage in a left main artery or proximal LAD, we have to treat it with stents or surgery. But let's say there is a significant blockage in any other part of the heart like the RCA, circumflex, or distal LAD. In that case, if a person is not having a heart attack, then we still first treat just with medications without putting a stent. Meaning we will give you medications like aspirin, statin, beta blocker, and some other anti-anginal medications, which can help to dilate the blood vessels that supply blood to your heart and can also help to reduce the oxygen demand of your heart muscle. Many people will have significant relief or complete resolution of their symptoms just with these medications, and therefore stents are not required for everyone. On the other hand, if we have tried the medication for a few weeks and you are still having symptoms, then we may still need to go and put a stent in even if the blockage is not in the proximal LAD or left main. So friends, I know this is a little bit of a complicated topic, but in short, I would just try to tell you that blockages are categorized as mild, moderate, and severe. Mild blockages are treated just with medications. For moderate blockage, 50 to 70%, we need to do additional testing like FFR to see whether they are significant or not. And when there are significant blockages, more than 70%, then we have to see where the blockage is. If it's in the left main or proximal LED, we try to fix it right away. Otherwise, we try to first give a chance to medications. And lastly, if someone has a heart attack, then we try to open up the vessel regardless of where the blockage is located. I hope you found some clarity on this topic. And if you have any other follow-up questions regarding this topic for me, please leave in the comment box. Thank you.